Here are 10 serious diseases that don't have symptoms until it's almost too late. Could one of these be lurking in your body? 1. Lung cancer. Lung cancer is a health condition that can be particularly stealthy, often not revealing itself through noticeable symptoms until it has reached an advanced stage. In the early stages of lung cancer, individuals typically don't experience any symptoms, which makes this disease especially tricky to catch early on. It's only in the later stages that more evident symptoms, such as a persistent cough, coughing up blood, or experiencing shortness of breath, begin to appear. These symptoms signal that the cancer has developed to a point where it demands immediate medical attention. This subtle onset is a stark reminder of the importance of being aware of the risk factors associated with lung cancer, which include but are not limited to smoking, exposure to secondhand smoke, and prolonged exposure to hazardous substances. It highlights the need for regular health checkups, especially for those who may be at an elevated risk of developing lung cancer. Early detection plays a critical role in the effectiveness of treatment for lung cancer, increasing the chances of a positive outcome. Therefore, it's essential to consult a healthcare professional if you notice any concerning symptoms or changes in your health, as they can provide the necessary guidance and support. 2. High blood pressure. Hypertension, or high blood pressure, is often referred to as the silent killer because it can quietly and persistently damage your body long before any severe symptoms become apparent. This condition occurs when the force of your blood pushing against the walls of your blood vessels is consistently too high, which can eventually strain and damage your heart and arteries over time without any noticeable signs. The absence of symptoms means many people may live with hypertension for years without knowing it, unwittingly allowing it to lead to more serious complications such as heart attacks, strokes, kidney damage, and even vision loss. Several risk factors contribute to the development of hypertension, including a family history of the condition, age, sedentary lifestyle, poor diet, obesity, tobacco use, and excessive alcohol consumption. It's crucial to understand these risk factors because, by addressing them, you can significantly reduce your risk of developing high blood pressure. For instance, maintaining a healthy weight, engaging in regular physical activity, eating a balanced diet high in fruits and vegetables, and limiting alcohol and tobacco use can all help manage or prevent hypertension. Detecting hypertension early is key to managing it and reducing the risk of heart disease and stroke. Since it typically doesn't cause symptoms, the best way to know if you have high blood pressure is through regular checkups with a healthcare provider who can measure your blood pressure using a simple and quick test. If you're at an elevated risk or have concerns about your blood pressure, seeking medical advice is a critical step in taking charge of your health and preventing the potentially life-threatening complications associated with this condition. 3. Ovarian cancer. If you are enjoying this content, please remember to hit the like button and subscribe to our channel. Ovarian cancer, often termed a silent disease, has a way of developing quietly within the body, making it particularly insidious and challenging to detect early. This type of cancer starts in the ovaries, which are small almond-shaped organs on either side of the uterus that produce eggs, as well as estrogen and progesterone hormones. As ovarian cancer grows, it can spread within the pelvis and abdomen before it starts to produce symptoms that are noticeable. Unfortunately, when symptoms like bloating, pelvic or abdominal pain, and difficulty eating or feeling full quickly do appear, they are often vague and can easily be mistaken for more common, benign conditions such as digestive issues. This similarity in symptoms leads to delays in diagnosis until the cancer has reached an advanced stage. The risk factors for ovarian cancer include older age, genetic predisposition, a family history of ovarian cancer, never having been pregnant, and certain fertility treatments. It's important to note that many women with ovarian cancer do not have these risk factors. Early detection strategies primarily involve being vigilant about bodily changes and symptoms. Regular pelvic exams are part of routine women's health checkups, but they are not typically effective in detecting ovarian cancer at its earliest stages. For women with a high risk of ovarian cancer, doctors may recommend additional screening methods, such as transvaginal ultrasound or blood tests, that look for specific markers associated with cancer. Despite the challenges in early detection, if you experience persistent symptoms that are unusual for you, it's crucial to consult a healthcare professional for advice and further evaluation to rule out ovarian cancer or to catch it in its earlier, more treatable stages. 4. Pancreatic cancer. Pancreatic cancer is another sneaky disease primarily because it remains hidden, with symptoms often not surfacing until the cancer has reached an advanced stage. This type of cancer begins in the tissues of the pancreas, an essential organ located behind the lower part of the stomach that aids in digestion and regulates metabolism. As pancreatic cancer develops, it grows within the pancreas and may start to spread to nearby organs and tissues. In its early stages, it rarely causes symptoms, which makes it difficult to detect and treat effectively at a point when the disease might be more manageable. The risk factors for pancreatic cancer include smoking, chronic pancreatitis, inflammation of the pancreas, diabetes, a family history of pancreatic cancer, obesity, and certain genetic disorders. Despite these known risks, the absence of early symptoms means that many cases of pancreatic cancer are not diagnosed until they are advanced, contributing to the challenge of treatment. When symptoms of pancreatic cancer do appear, they can include pain in the upper abdomen that radiates to the back, jaundice, yellowing of the skin and eyes, weight loss, loss of appetite, and nausea. These symptoms, however, can be associated with many other conditions, making pancreatic cancer particularly tricky to pinpoint without further medical testing. For detection, medical professionals may use a combination of physical examinations, imaging tests like CT scans or MRI, blood tests, and biopsies to diagnose pancreatic cancer. Due to the subtle nature of its symptoms and the severity of the disease, if you or someone you know is experiencing any unusual or persistent symptoms, it's essential to seek medical advice. Early consultation with a healthcare provider can help in identifying the cause of these symptoms and, if necessary, initiating prompt and appropriate care. 5. Kidney disease. Kidney disease is a condition that often goes unnoticed in its initial stages, primarily because it typically does not present any symptoms early on. The kidneys, vital organs located in the lower back, are responsible for filtering waste from the blood and regulating fluid and electrolyte balance in the body. When kidney disease develops, it means that the kidneys are damaged and can't filter blood as well as they should. This damage accumulates gradually, and as the disease progresses to more advanced stages, symptoms like swelling in the legs and feet, fatigue, and frequent urination begin to manifest. These symptoms occur because the kidneys are less able to maintain the proper balance of fluids and minerals in the body, leading to an accumulation of waste products in the blood. Risk factors for developing kidney disease include diabetes, high blood pressure, heart disease, smoking, obesity, high cholesterol, and having a family history of kidney failure. Certain ethnic groups, such as African Americans, Native Americans, and Asian Americans, are also at higher risk. The sneaky nature of kidney disease, with its late-onset symptoms, underscores the importance of being aware of these risk factors and managing any existing health conditions properly. Detecting kidney disease involves a series of tests that may include blood tests to check for waste products, such as creatinine, and urine tests to look for the presence of protein or other substances that should not be there if the kidneys were filtering properly. Since early kidney disease does not usually show symptoms, these tests are crucial for people who are at risk, given the serious implications of advanced kidney disease, including the necessity for dialysis or a kidney transplant. Seeking medical advice if you are at risk or if you start noticing any related symptoms is essential. 6. Glaucoma. Glaucoma is a group of eye conditions that pose a serious threat to vision by damaging the optic nerve, which is vital for sight, and this damage is often linked to an increase in pressure within the eye. In the early stages, glaucoma tends to be a silent assailant, showing few, if any, symptoms, making it difficult for individuals to realize they have the condition until it has progressed significantly. Unfortunately, by the time vision loss occurs as a result of glaucoma, the damage is irreversible, underscoring the condition's reputation as a leading cause of blindness for people over the age of 60. However, it's important to note that while glaucoma can lead to severe vision loss, not everyone with the condition will go blind, especially with early detection and treatment. Risk factors for glaucoma include a family history of the condition, age, particularly being over 40. Certain medical conditions like diabetes, high eye pressure, and extreme nearsightedness or farsightedness. Ethnicity also plays a role, with African Americans, Asians, and Hispanics being at higher risk compared to others. Because glaucoma can develop without early warning signs, being aware of these risk factors is crucial. The primary method of detecting glaucoma is through a comprehensive eye examination that includes tests to measure internal eye pressure, inspect the drainage angle of the eye, check the optic nerve for damage, and test the peripheral vision. These tests are critical because they can help identify the presence of glaucoma before significant vision loss occurs. Given the stealthy nature of glaucoma and its potential to cause irreversible harm, if you have risk factors for glaucoma or are concerned about your eye health, seeking medical advice from an eye care professional is a crucial step towards preserving your vision. Regular eye exams are key to detecting glaucoma early and preventing the progression of vision loss. 7. Type 2 diabetes. Type 2 diabetes is a chronic condition that affects the way your body processes blood sugar or glucose, which is a crucial source of energy for the cells that make up your muscles and tissues. In type 2 diabetes, your body either resists the effects of insulin, a hormone that regulates the movement of sugar into your cells, or doesn't produce enough insulin to maintain normal glucose levels. This condition develops gradually over time, and its early symptoms, such as increased thirst, frequent urination, hunger, fatigue, and blurred vision, can be so mild that they're easily overlooked. However, without proper management, type 2 diabetes can lead to more severe health issues, including heart disease, kidney damage, vision loss, and nerve damage, highlighting the importance of early detection and treatment. Several risk factors increase the likelihood of developing type 2 diabetes, including being overweight or obese, leading a sedentary lifestyle, having a family history of diabetes, being older than 45 years. Certain ethnic groups, such as African Americans, Hispanic Americans, Native Americans, and Asian Americans, are also at a higher risk. Detecting type 2 diabetes usually involves a series of blood tests to measure your blood sugar levels. These may include the A1C test, which shows your average blood sugar level over the past 2 to 3 months, or the fasting plasma glucose test, which measures your blood sugar after an overnight fast. Given the potential complications associated with unmanaged diabetes, if you're experiencing symptoms of type 2 diabetes or fall into one or more of the high-risk categories, it's critical to seek medical advice. Early diagnosis and treatment can help manage the condition effectively and prevent or delay the onset of more serious health problems. 8. Hepatitis C. Hepatitis C is a viral infection that targets the liver, leading to inflammation. Initially, the infection often flies under the radar, as many individuals do not experience symptoms in the early stages, making it particularly stealthy and potentially dangerous. Over time, if left untreated, it can cause serious damage to the liver, including conditions like fibrosis, scarring of the liver, cirrhosis, advanced liver scarring, and even liver cancer, which underscores the severity of the disease and the importance of early detection. The risk factors for contracting hepatitis C primarily involve coming into contact with the blood of an infected person. This can happen through sharing needles or other equipment, receiving contaminated blood transfusions or organ transplants, mainly a risk before 1992 in the United States. Being born to a mother with hepatitis C. Healthcare workers may also be at risk through needle stick injuries. Given these risk factors, being aware of your potential exposure to the virus is crucial. Detecting hepatitis C involves a blood test, which can identify the presence of the hepatitis C virus antibodies, indicating a past or current infection. If the initial test is positive, a follow-up test can determine if the infection is active. Early detection is vital because it allows for treatment options that can potentially cure the infection, significantly reducing the risk of liver damage and other serious complications. If you think you may have been exposed to hepatitis C or have risk factors for the disease, seeking medical advice is a critical step towards ensuring your health and preventing the progression of the infection. 9. Chlamydia. Chlamydia is a common sexually transmitted infection, STI, that can quietly infiltrate the body without showing any symptoms, making it a silent threat to an individual's reproductive and general health. This bacteria-based infection affects both men and women. The tricky part about chlamydia is that it can go unnoticed for a long time because many individuals do not experience noticeable symptoms, which means they might unknowingly pass the infection to others. When symptoms do appear, they might include pain during urination, unusual discharge, and pain in the lower abdomen, but these can easily be overlooked or mistaken for other conditions. Early detection through simple urine tests or swabs can prevent the infection from causing long-term health issues such as infertility, ectopic pregnancy, and chronic pelvic pain. Given the potential for serious health complications associated with chlamydia and its ability to be cured with antibiotics when detected early, seeking medical advice for regular STI screenings is crucial. And finally, number 10 is high cholesterol. High cholesterol is a condition that silently progresses within the body, often without any symptoms, yet it poses a significant risk to heart health. This condition occurs when there is too much of a fatty substance called cholesterol in the blood. While cholesterol is necessary for building healthy cells, too much of it can lead to the buildup of plaques in the arteries, making them narrow and hard. This process, known as atherosclerosis, significantly increases the risk of heart disease, including heart attacks and strokes. The danger of high cholesterol lies in its silent nature. Most people are unaware of their high cholesterol levels until they are diagnosed during a routine health check or after a cardiovascular event. Several risk factors can contribute to high cholesterol. These include an unhealthy diet, rich in trans fats, lack of physical activity, obesity, smoking, excessive alcohol consumption, and genetic factors. Age and family history also play a role, with the risk increasing as you get older, and if there is a family history of high cholesterol or heart disease. Detecting high cholesterol requires a simple blood test known as a lipid panel, which measures the levels of various types of cholesterol and triglycerides in the blood. Because of its asymptomatic nature, regular screening is crucial for early detection, particularly for individuals with risk factors for heart disease. If you have risk factors for high cholesterol or heart disease, it's essential to seek medical advice for appropriate testing and potential treatment to manage your cholesterol levels and reduce the risk of heart disease. This proactive approach is key to maintaining heart health and preventing the serious consequences associated with high cholesterol. These examples underscore the importance of regular health checkups and screenings, especially for individuals at higher risk due to family history, lifestyle factors, or other underlying conditions. Thank you for watching 10 serious diseases that don't have early symptoms on healthy vibrants. Don't forget to like, subscribe, and turn on notifications. Our goal is to bring you the best health content because our wish for you is to be healthy and vibrant. See you in the next video.